everyone, this is Jess from IWG. I'm here with Dr. Nicole Rivera. We are here for our Parasite edition of our 6-part series. So Dr. Nicole, I guess we can start by just saying, how do you define parasites?
So parasites are always an interesting conversation that I have to have with patients. And usually the follow-up statement is, well, I didn't go to Mexico and drink the water. So with parasites, primarily what we're describing is there are so many different types of parasites that exist. Traditionally, you hear about maybe different types of like tapeworms and things like that that can get into the gastrointestinal system. So when you see people that are very thin that eat a ton, they make the joke of like, oh, you must have a tapeworm. Unfortunately, it's just parasites are a lot more common than people realize. And usually they're not those really good parasites that make you thin. Sometimes they're just causing a lot more problems than that. And a lot of these parasites we get exposed to by our pets, we get exposed to by contamination in water, and also contamination through food, which we kind of talked about in our first part of our series. It's definitely something that it plays a bigger role in people's systems than they realize.
So how do parasites affect chronic disease?
Well, parasites are interesting because everyone is affected differently. There are some people that are going to manifest the traditional gastrointestinal symptoms. They might be dealing with loose bowel movements, diarrhea. They might be dealing with bloating or occasional stomach cramping or pain. So one of the very interesting things that I bring up in my consultation with patients is I'll usually ask, how many times in your life have you had food poisoning? And, some people say, I've never had food poisoning. So I usually follow up with how many times in your life have you had a stomach bug, stomach flu, stomach virus, etc. And they're like, oh, I get those all the time, or I had them a lot as a kid. And what's interesting is it's not very common to actually just get a viral infection that's going to wreak havoc on your gastrointestinal system. It's more than likely at periods of time when you've had those types of experiences that you've come across a parasite. So they're definitely more common than people realize, but what's interesting about parasites is you and I and everyone else, we are the most perfect environment for them to live. We're warm, we're cozy, and they get to eat all of our nutrients. So they're usually not leaving on their own. Usually they want to stay within the system. And I think this is an important factor for people to understand that if you have maybe had bouts when you were young of a lot of stomach aches and maybe you had a lot of those stomach flus or you had a lot of food poisoning, then later in life, it's not that you're going to have something as severe as Crohn's or IBS or ulcerative colitis, but you can definitely have just these low-grade issues with your gastrointestinal system because it's never been able to heal.
So I know a lot of people have gone to their doctor and gotten blood work done, and then they come here and say, oh, I don't have any parasites. So can you kind of discuss the different ways that we find parasites within our...
Yeah, so I'm so glad you asked that because parasites are extremely hard to diagnose. They usually do not come up through blood work at all unless you have a blood-oriented parasite. So like malaria is actually classified as a blood parasite. And outside of that, when you're trying to really specifically look at gastrointestinal related parasites, you actually need to collect a stool sample from the patient and put it under a microscope within 20 minutes of it leaving the body. So that is not happening very often. And the other traditional mechanisms of testing is going to be colonoscopy as well as endoscopy. You have no capabilities of analyzing the microbiology, aka infections, through those types of approaches. They're strictly looking visually at the system to see if there is polyps, cancer, inflammation, lesions, ulcers, etc. So it does not have the capabilities to look for organisms. So traditional colonoscopies and endoscopies will not give you information there. So primarily what we do is we use a combination of very, very specific types of stool samples. There is also saliva tests that can be used that will evaluate the DNA of parasites. And then lastly, we use autonomic response testing, which is an in-house diagnostic that we use to test the frequencies of certain parasites against the body.
So when I think about parasites, I think about them in the gut region. Is there anywhere else in the body that they kind of live and thrive?
Yeah, so I mentioned prior that there are some parasites that can come from our pets. I'm not telling you to get rid of your pets by any means. I love my puppies. But what's interesting is there are a couple parasites that have been studied in depth, and they're actually derived from cats. So one of them is actually called Toxoplasma, and the University of Penn, so UPenn, has actually done studies on evaluating the brain and the damage that Toxoplasma can do. And the primary studies, what it's shown from a symptomatic standpoint, is Toxoplasma is associated with bipolar. And it's not always going to manifest as that textbook bipolar, but it can definitely manifest as anxiety. It can manifest as feeling very manic, and it can also manifest as a low-level depression as well. So there are parasites that can reside in the gut, there are parasites that can affect the brain, and then there are parasites that can live in the red blood cells, which is malaria, like we mentioned prior.
So other than our pets and different food items, is there another way that we can contract parasites?
Yeah, so with parasites, I mentioned in our prior edition that we did was in reference to a lot of parasites can reside in the water. And what was very, eye-opening to me is that when I moved back to New Jersey, one of my goals was to get a water purification system for the place that I was living. And I remember evaluating a very specific system, and one of the things that it mentioned was it removed parasites from the water. And I just remember thinking, why are there parasites in my water? And at that point, it was very interesting because it has a lot to do with contamination from farms and runoff. And what they're finding is that there are certain parasites. This is our puppy. Like I said, don't have to get rid of your pets. There are certain parasites that actually can survive past ammonia as well as chlorine, which are the general agents that we use to clean the water.
Filtered water.
He loves the filtered water too. So I guess he's going to be our special guest right now. So outside of that though, just something too from a food perspective that I think is really, really important is, you know, we live in a world that I feel like a lot of people are struggling on what to eat and what's good and what's bad. And we want to gravitate sometimes away from meat, and we hear that going vegetarian is better, or vegetarian with a little bit of fish. And what's so interesting about that is when you're dealing with fish, because of how much things have changed and we're dealing with farmed versus wild, that can play a very, very big role in the exposure to parasites. So farmed fish is something that is traditionally being bioengineered to some capacity. It's not coming from the wild anymore, and these are types of fish that are known to have high levels of parasites. So there we go, the cuteness factor, just killing it.
So once you're diagnosed with a parasite, I mean, do you want to share a little bit about how we go about treating that?
Yeah, definitely. So with parasites, primarily, you don't want to fall into a cookie cutter protocol. I have many people that have come to see us and they've maybe thought they had parasites because they researched some of the symptoms, or they have worked with other practitioners and been put on very specific parasite protocols. And what I find is that when you're dealing with parasites, you really have to take other things into consideration. And what I mean by that is you have to evaluate, are there other infections that are happening? Is there mold exposure? Are there viruses? Are there other types of bacterial infections? Because what's so interesting about parasites is, I mentioned before that they have a tendency to eat our nutrients. So they're not biased. They will eat other things. They actually have no preference. They will eat molds. They will eat bacteria. They will eat different types of toxins. So sometimes when you go on a parasite protocol and you start killing off these parasites, they can unleash other infections that are present and cause a lot of problems. And at that point, that's when people start saying, I'm feeling really sick, but I guess this is part of it because I'm detoxing. And really, at the end of the day, you want to make sure that all avenues of detoxification are supported, number one. And number two is if there is mold or other types of bacteria in the lab analysis, we want to make sure that we're also supporting that from kind of start to finish. So it's usually not about dousing yourself in tons and tons of antiparasitics. It's having a more comprehensive approach.
Okay. How would you recommend that our friends out there kind of try their best to prevent getting a parasite?
My two disclaimers to my patients is don't eat fish out because I worked in many restaurants and unfortunately you don't know what you're getting unless you're going to a very reputable place. I would also be very, very careful with sushi, especially red snapper, because red snapper has been proven by many studies that the DNA doesn't match. So I don't really know what they're serving. What they say is it's a version of a tilapia that's bioengineered. And then my other disclaimer is do not consume pork products out. So don't go to the diner and eat bacon or sausage. Please don't do it.
Breaking hearts in New Jersey
I
everywhere.
know, pork roll, egg and cheese, right? So overall, you know, you want to kind of just use some of these baseline tips in order to prevent the exposure to parasites. But one of the biggest things is really just maintaining a healthy immune system is really, really important. So it's just a matter of getting blood work and figuring out, you know, if your immune system needs some support, and that's really the best thing you can do to protect yourself.
Great. Well, thank you, Dr. Nicole. And we'll look forward to seeing you at our next episode. We're discussing Lyme's disease.
Bye, everyone.